Hi everyone, I'm Heather Wen, a retired nurse practitioner and the founder and practitioner at Arizona Healing Alternatives. On this channel, you'll find several videos, what I like to call aha moments, where we'll be discussing issues that impact your health. So whether you decide to use Western medicine, alternative medicine, or even a mix of both, I'm passionate about you knowing what your options are. For today's aha moment, I'm going to be talking to you about couple of little known chiropractic techniques that could be helpful for you, so stay tuned. So what I found interesting when I was going through my training as a total body modification or applied kinesiology practitioner, I found it interesting that Dr. Viktor Frankl, who's the chiropractor, naturopath, DO, he actually would separate out the class. You had to be a medical person to be trained. And then he would separate out the class and put non-chiropractors on one side of the room and chiropractors on the other, and showed us non-chiropractors some cool little techniques that we could do to try to help structurally align. Now, of course, if this didn't help align the spine, because we can't do spinal manipulation, I am not trained to do that, but these little tiny stretching techniques could actually put the body in alignment. And I've done other videos on, with the stories of energy medicine or woo-woo, or the little sections of chiropractic care, can go into all that explanation. But what I wanted to show you is kind of how this relates to even the Western world when it comes out to what a practitioner may be trained or not trained. As we know, you could actually go to, let's say, an ear, nose, and throat specialist. When you go to that specialist, they may not be have certain techniques that another ear, nose, and throat specialist might have. So everybody has different exposure, whether it's different colleges that they went to or different schools, different training. And where this came to me and kind of made me passionate about doing this video was when I was wanting to continue to expand my skills and getting some more education. And I ended up watching Viktor Frankl's video called The Art of Chiropractic that's on the TBM website, and I got it from there. And it was amazing to me because, of course, a lot of it was chiropractic techniques that, I couldn't do because I'm not a chiropractor. But there are many times that I see somebody in the office and there are these little techniques that he taught us to do that in some cases, that's all my patients need when it comes to pain or sinus issues or whatever it is. But like I said, oftentimes I will send somebody to a chiropractor because there are more techniques they have. But one of the ones as an example I want to use is even in my practice as a Western medicine practitioner, what I found was I'm pretty old school. As I joke around with people, I went through nursing school a long, long time ago. I joke around it was 1832. Not then, it was like 1991, 1995. But it feels like 1832. But basically with that, there are techniques that practitioners now don't do anymore. I mean, we have a lot more technology than we had back then, which is wonderful. But sometimes some of the old-fashioned skills, like, we used to do percussion, which is where you tap and then you can hear different sounds on the body. So you can hear if there are fluid collections or solid collections of stuff. And it can pick up a lot of stuff that, we don't do that. We just go get an MRI, we go to get an ultrasound, we get a CT scan. But those scans don't necessarily pick up everything. So it's one of those things. And there's another thing that I send people when I tell them to go to gynecologists, because I was in the women's healthcare nurse practitioner is the field that I was in. There are certain times when we would put bodily fluids, and I'll spare you as to what ones, but bodily fluids on a microscope slide. And I would go look under the microscope and instantly I could diagnose somebody. Well, I have told many of my patients, if you're going to see somebody, make sure they can do that skill. Because yes, could you send a culture off and grow it in the lab for 3 days? But some stuff doesn't survive that. Now, we've gotten better as to trying to make it survive, but there's certain infections and stuff that may not survive that route, whereas you can just go outside and look under a microscope and then you'll know. But a lot of practitioners don't have that skill anymore, and it's really, really sad in my opinion. But example in my practice of doing applied kinesiology was Viktor Frankl taught us this really cool chiropractic technique called fixing the rib torque. And what happens is, and I don't know if you can see it, but if your rib cage is off, one side is lower than the other, one side's higher, one side's lower, He called that the great imitator, that it can imitate. It can cause things like heartburn, it can cause back pain, it can cause all sorts of problems. And what I found really interesting when I've talked to many, many chiropractors, there are some people that still know that technique, and similar to Western medicine with what's called that wet mount, some people don't know this technique. And so it's something that I'm really passionate about people knowing anytime they see a practitioner, is to find out what this skill level they have, because there are some chiropractors that do just the activator, and I'll show you that. They do just this activator tool, and that way they're not completely doing what's called spinal manipulation, where you hear that popping and cracking. So they're just using this tool and can align the spine that way. There are some people who are very skilled at that. There are some people who are very skilled at doing that spinal manipulation. And then this technique, he taught us, as a simple stretching technique. Now, I don't suggest you do this at home because there's a different way that you have to do it, but it stretches that rib cage into bringing it into alignment. And when that rib cage goes into alignment, then I've seen somebody with 20 years of back pain, that's all I did, and all of a sudden it's gone, and they've tried, they had tried everything. So it's fascinating, and it kind of brings the point to me when I was watching these really cool techniques that some, of course, I could do and put into my practice for sinus corrections. And there's another correction that he showed us a long time ago called, it's called an anterior femur head. And the femur is that bone that sits at the top of the leg that sits in that pelvic socket, that it's putting that back in place, because sometimes it can be off just by a little bit. And I've had people have this horrible pain, and especially groin pain. They have that pain and it really, really hurts, and it goes and radiates towards the back. Sometimes that's all they need, and he taught us how to do that. Now, I'm sure many chiropractors do that as well. But the point of all of this is just to say that every single practitioner has different techniques, different things that they do. And I've had some wonderful chiropractors that I've gone into and said, "Oh, do you do this rib torque?" And they're like, "No." And I said, "Do you know why they don't train chiropractors to do that anymore?" Because I thought, well, if there's something dangerous, then I'm certainly not going to be doing it. But I know Viktor Frankl wouldn't have taught us something that was dangerous. So they say they don't know. It just wasn't trained. They weren't trained how to do it. So that being the case, it's about asking your practitioner. And I've told my practitioners, "Ooh, can you do this and correct this for me?" And many practitioners are so open and will go, "Of course I'll do that." Or if they're uncomfortable, they'll let you know, and they'll let you know why. But once again, what's the point of this video? It's to show you that it doesn't matter if you're going to an ENT, ear, nose, and throat person, going to an OBGYN, going to a chiropractor, going to an acupuncturist. It's finding out that every single practitioner has a different skill level and different kind of set of tricks and tools that they have that could potentially help you. So it's about asking and knowing what's out there, which is why even in Western medicine, people get second opinions, especially if they're going to go for surgery or things like that. Getting a second opinion is a really good idea, because everybody has a different set of little tools or tricks or whatever they have up their sleeve. So I hope you've enjoyed this video. I hope it's helped you kind of know that there are different options out there for you. If you like what you've seen, you can hit that subscribe button, and then you can hit the notification bell so that anytime new videos come out, you'll be notified. So once again, do your homework, find out what people can do for you so that you can be the best that you can be on all levels. Have a great day.